Hello, my name is Dr. Dewan S. Raja. Today I will discuss about paraneoplastic syndrome. What is paraneoplastic syndrome? The paraneoplastic syndrome includes signs and symptoms that cannot be readily explained by the anatomic distribution of the tumor or by elaboration of hormones indigenous to the tissue from which the tumor arises. Occurs in about 10% of cancer patients. Most common paraneoplastic syndromes are hypercalcemia, excessive level of calcium in the blood, Cushing syndrome. We'll look at the picture: moon face, buffalo hump, central obesity, and a lot of steria are the features of Cushing syndrome. Non-bacterial thrombotic endocarditis. So, hypercalcemia, Cushing syndrome, non-bacterial thrombotic endocarditis are most common paraneoplastic syndrome. Okay, so clinical syndrome: hypercalcemia, major frontal neoplasias, common cell carcinoma of the lung, breast carcinoma, renal carcinoma, adult T-cell leukemia, lymphoma. Causal mechanism or agent: parathyroid hormone related protein and TGF alpha. Cushing syndrome is associated with small cell carcinoma of the lung. Causal mechanism: ACTH or ACTH-like substance. SIDA, syndrome of inappropriate antidiuretic hormone. Major forms of the neoplasia: small cell carcinoma of the lung, intracranial tumor. Causal mechanism: antidiuretic hormone or atrial natriuretic factor, also called atrial natriuretic protein. Hypoglycemia, decreased level of glucose in the blood, associated with fibrosarcoma, ovarian carcinoma, other mesenchymal sarcoma. Mesenchyme means embryonic connective tissue, something derived from embryonic connective tissue or mesenchymal structure. And the causal mechanism or agent is the insulin or insulin-like substance. Polycythemia, that is increased level of RBC, WBC, and platelet, that is the thrombocytes. All three form element of the blood will be increased. We call polycythemia, and this polycythemia is associated with renal cell carcinoma, cerebellar hemangioma, hepatocellular carcinoma, and the causal mechanism or agent is the erythropoietin. Okay, so here we'll go there. Paraneoplastic syndrome, clinical syndrome: myasthenia, major forms of the neoplasia, bronchogenic carcinoma, thymoma. Thymoma is the tumor of the thymus gland. Okay, that is associated with T lymphocyte production. Here, this myasthenia related to this type of tumor. Thymoma may be benign in most cases, but it may be also malignant. Okay, and causal mechanism is immunologic. There will be antibody formation that will occupy the post-synaptic receptor for acetylcholine, and that will cause muscle weakness in myasthenia gravis. Acanthosis nigricans, there will be pigmentation at the neck or around the axilla. Associated with gastric carcinoma, lung carcinoma, uterine carcinoma. Causal mechanism: immunologic, secretion of epidermal growth factor. Dermatomyositis is associated with bronchogenic carcinoma or breast carcinoma. Causal mechanism is immunologic mechanism. Venous thrombosis, also called Trousseau phenomenon. Major form of neoplasia is the cancer of the pancreas, bronchogenic carcinoma. What is the mechanism or cause, the agent? Here, tumor product mucin that activates clotting. Non-bacterial thrombotic endocarditis. Major forms of neoplasia is any advanced cancer. And causal mechanism is the hypercoagulability. Anemia may be associated with thymoma and its cause is immunologic. Nephrotic syndrome, various type of cancer, many cancer may cause nephrotic syndrome, and its causal mechanism or agent is the tumor antigen immune complexes. Hypertrophic osteoarthropathy and clubbing of fingers is seen in bronchogenic carcinoma. The mechanism for this, why this happened, like the clubbing of finger in a bronchogenic carcinoma patient, we don't know the exact cause. So the cause of hypertrophic osteoarthropathy and clubbing of finger in a patient with bronchogenic carcinoma is unknown. Okay, so we'll just read some images. These are taken from Microsoft PowerPoint online picture. This is the Acanthosis nigricans. It may around the axilla also possible. This is the Acanthosis nigricans. This pigmentation cannot be removed, okay, and without damaging or abrating too much to the skin. Okay, here are the clubbing of finger. This is the drumstick-like distal finger, and it has a lot of importance. It may be associated with bronchogenic carcinoma, with chronic obstructive pulmonary disease. Many causes are that of this drumstick finger. We call it clubbing. Okay, here another clinical manifestation of certain type of tumor is the dermatomyositis. Okay, so, and this is another type of paraneoplastic syndrome is Cushing syndrome. A lot of styria in the abdomen, lower abdomen, and moon faces. Okay. Okay. And that's all about the paraneoplastic syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.